The emergency alert text was sent out from the governor statewide at 9 p.m. Sunday night, declaring a state of emergency due to unsustainable growth of COVID-19.
Therefore, tonight, I'm declaring a new state of emergency to address hospital overcrowding and to protect intensive care unit capacity.
The governor not only placed a mask mandate for the following 2 weeks, but he also placed limits on social gatherings, banned extracurricular activities except college practices or high school sports championships, and is requiring weekly testing of students on college campuses. During a virtual press conference on Monday, hospital officials and several local mayors supported these new mandates.
We're moving in the wrong direction, and we have an opportunity to turn this around. And the good news is, by doing the things that the governor has outlined, we have an opportunity to do just that, to turn things around.
So I urge my own residents and residents around the county to follow this request and frankly the governor's order to wear these masks and see if we can't make a difference.
I believe that we can take a break from our unstructured social gatherings beyond our households for 2 weeks, and I really believe that will make a difference. This will allow us to keep our businesses, our churches, our educational system open.
The executive order also limits household-only gatherings until November 23rd and possibly into Thanksgiving.
I'm hoping that we'll be able to have Thanksgiving with my immediate family, but if we don't, then it'll simplify the cook's job for sure. But we need to do some things. We're vulnerable. We've got a very small city staff in Santa Clara, and I'm trying to put myself in the perspective of the hospital.
For months now, hospital officials have asked the public for help as the pandemic continues to surge up and down and infection spreads.
In the last week, we had more patients test positive, more people test positive for COVID-19 that were 80 years old or older than any other time in the pandemic. The virus spread is not staying with the college age students. It's spreading to other age groups. It's spreading to parents. It's spreading to grandparents. And what college age students and what high school students do does matter.
This will begin with weekly testing for our university students and expand to include high school students who participate in extracurricular activities, people in the workplace under the age of 35, and our high school teachers. We will also expand the role of our National Guard in testing and contact tracing.
Besides wearing a mask, the mandate also requires you maintain 6 feet social distancing.
And that we social distance, that we maintain that 6-foot distance, that we take those precautions, that we stay home when we're not feeling well. Go get a flu shot.
While fines were mentioned in the governor's address for those who don't comply, local officials are hoping they can count on the citizens and employers to do the right thing.
As the governor, I think, mentioned in his remarks, we have seatbelt laws. They protect us and others. We have speed limits. We have other laws that we don't seem to mind giving up, if you will, a portion of our own freedom for the ability to protect ourselves and others.
It's very real, and the measures that we're advocating are extremely effective. The debate is over, and we're just grateful for the support we have from our local leaders that are helping to make this happen.
But we cannot wait upon a vaccine, knowing the havoc that this pandemic has wreaked on families, schools, and businesses. We must do more, and we must do it now.
Health officials hope this 2-week countdown will bring COVID numbers down so further action won't have to be taken. In Washington County, Melissa Anderson, Community Education News.